Geisinger Gold wants to help you make the most of your Medicare benefits. The best way to do that is to understand how Medicare works. This video explains it all in 4 simple steps. Step 1. Get to know Medicare. There are 4 parts to Medicare: Parts A, B, C, and D. Part A is hospital insurance. It pays benefits when you're admitted to a hospital or skilled nursing facility. It also covers home health and hospice care. Part B is medical insurance. It pays for medical services outside of the hospital. That includes doctor's visits, medical services, and supplies. Then there's Part C, known as Medicare Advantage. This can be a little confusing, because it really isn't another part of your Medicare benefits. It's an option that lets you choose a private insurance company to provide your Medicare Part A and B benefits. A Medicare Advantage plan will cover all the medical and hospital benefits you get from Medicare, and it often includes some extra benefits that Medicare doesn't cover, like routine dental and vision services and eyeglasses. Some Medicare Advantage plans even include fitness benefits. The final part of Medicare is Part D, prescription drug coverage. This benefit helps pay for the cost of your medications. That's Medicare in a nutshell: hospital, medical, and prescription drug coverage, plus the option of having a private insurance company cover your hospital and medical benefits. It's how you choose to put those parts of Medicare together that will determine the benefits you have. It's important to note that no matter what options you choose, your Medicare benefits are not free. There's a cost associated with each part of Medicare. Let's take a quick look. Part A. There's no monthly premium for your Medicare hospital insurance, but there is an deductible. Part B. Your Medicare medical benefits come with a monthly premium, an annual deductible, and co-payments. Part C. If you choose a Medicare Advantage plan, you need to keep Medicare Parts A and B, so you'll need to pay your Part B monthly premium in addition to a premium for your Medicare Advantage plan. The cost of that premium depends on the plan you choose. You have many options, including plans with no monthly premiums, no deductibles, and no copays. The same is true for Medicare Part D. There are many prescription drug plans with different premiums, deductibles, and copays. That covers step 1. Now that you understand your Medicare options, it's time to take the next step and learn how to enroll for benefits. If you have any questions along the way, remember, Geisinger Gold is here to help. Step 2. Get ready to enroll. Some people are automatically enrolled in Medicare Parts A and B, others are not. You'll be automatically enrolled the month you turn age 65, if you're collecting benefits from Social Security or the Railroad Retirement Board. If not, you must enroll to be covered. When's the right time to enroll for Medicare? That depends on whether you'll be retired at age 65 or still working. If you're retiring and want to take advantage of Medicare as soon as possible, sign up during the initial enrollment period. That's a 7-month period that includes the 3 months before your 65th birthday, the month you turn 65, and the 3 months after. Suppose you'll turn 65 on May 5th. Your initial enrollment period will start in February and last until the end of August. If you want your benefits to start at the earliest possible date, you must sign up in the 3 months before your birthday. If you do, your Medicare benefits can start on the first day of your birthday month. Should you enroll in Medicare if you're still working and your employer provides health insurance? It makes sense to sign up for Medicare Part A during the initial enrollment period, since it's available to most at no monthly cost. Whether or not you sign up for Part B depends on the size of your company. If your employer has 20 or more employees, there's no need to sign up. Your employer's plan will remain your primary coverage. But if your company has less than 20 employees, you should enroll in Medicare Part B. In that case, Medicare will become your primary insurer. Talk to your employer before you're eligible for Medicare for help understanding how your company benefits will work with it. And when you stop working, sign up for Part B during a special 8-month enrollment period. Keep in mind, this enrollment period begins when you stop working, not when your employer health benefits end. Sign up as soon as possible. If you miss this enrollment period, you'll have to wait for the next open enrollment period, and it could be months before your Medicare benefits actually begin. That's what you need to know to enroll in Medicare. Now it's time to take the next step and learn about one of your most important Medicare options. That is, the option of having your hospital and medical insurance provided by a private insurance company. This is known as Medicare Part C or Medicare Advantage. Step 3. Get the facts about Medicare Advantage plans. Let's start by looking at Medicare Parts A and B again. You'll recall Medicare Part A is hospital insurance. Medicare Part B is medical insurance that pays for services outside of a hospital stay. Here's where you have a choice. You can get this hospital and medical insurance through Medicare, or you can choose to get these benefits from a private insurance company. That's Medicare Part C or Medicare Advantage. So Medicare Part C is an alternative to Medicare Parts A and B. Sounds simple, right? That's the easy part. The hard part is choosing the kind of Medicare Advantage plan that's right for you. You have a number of choices. The price you pay and the additional benefits you receive depend on the plan you select. Keep in mind, even if you choose a Medicare Advantage plan, you need to continue paying your Part B premium. But you'll find some Medicare Advantage plans come with no additional monthly premiums, no deductibles, and no copays. And they include extras like routine dental and vision care, eyeglasses, hearing aids, even fitness benefits. Now that you understand your Medicare Advantage options, it's time to take Step 4 and learn how to make the most of your Medicare Part D prescription drug coverage. Step 4. Get the most from Medicare Part D. This coverage is available through Medicare, but it is optional. And if you don't sign up, you won't be covered. There are two ways to get Medicare prescription drug coverage. If you're enrolled in Medicare Part A or Part B, you can enroll in a standalone plan. That's a separate plan to cover your prescription drug costs. If you're enrolled in Medicare Part A and Part B, you can get this coverage as part of a Medicare Advantage plan. No matter how you purchase this insurance, all Part D plans work in the same way. They come with 3 distinct coverage periods. Once you meet an annual deductible, the first one begins. Your benefits start during this initial coverage period, and they continue until you reach a coverage limit set by Medicare. When you reach this limit, you enter the second coverage period, a coverage gap, known as the donut hole. While in this gap, you pay a much higher share of your drug costs. But here again, Medicare sets a limit, and once you reach it, you leave the donut hole and enter the catastrophic coverage period. During this period, you pay just a small percentage of your prescription drug costs for the rest of the year. All Part D prescription drug plans may work in the same way, but they have important differences too. They have different premiums and different co-payments, and not all cover the same drugs. So it's important to find a plan that covers the medications you need. What if you don't take any medications? Should you still sign up for Medicare Part D? Unless you enroll in a Medicare Advantage plan that includes prescription drug coverage, the answer is yes. Sign up at the same time you enroll in Part B. If you wait until later, you'll be charged a penalty for every month you put it off. That's our step-by-step guide to Medicare, and it leaves you with a lot of things to consider. Confused? You should know you don't have to do it alone. Geisinger Gold is here to help you understand your Medicare options and find the Medicare plan that's right for you. We offer free consultations, over the phone, and in most places, in person. Get in touch with us now.